What if I told you that there is a way to lower your blood pressure in just 5 minutes a day, using movements so simple that even someone with knee pain, dizziness, or constant fatigue could do them without risk? This method is specially designed for men and women over 50 who live with hypertension, swollen ankles, heavy legs, neck tension, nighttime cramps, or that constant anxiety every time the blood pressure monitor shows frightening numbers. What you are going to see today combines principles of modern physiotherapy, applied neuroscience, intelligent isometric exercises, and breathing techniques that act directly on your nervous system, helping to reduce blood pressure values quickly, safely, and completely naturally. The most striking thing, hypertension, the silent killer responsible for most strokes and heart attacks in Spain and Latin America, can respond surprisingly well to certain micromovements and specific muscle activations. Most people believe that only medication or endless cardio sessions can control it, but current science is showing something very different, something almost no one is teaching. And that is why, in this video, I will reveal the 5 secrets that are transforming the cardiovascular health of thousands of older adults and that could change your life as well, starting today. What almost no one has told you is that hypertension is not just a problem of pressure in the arteries, but a systemic condition deeply influenced by how you breathe, how you move, and how your nervous system responds to the accumulated tensions of daily life. Recent research in cardiometabolic physiology has shown that many adults over 50 develop silent arterial stiffness and an imbalance between the sympathetic and parasympathetic nervous systems, which keeps the body in a constant state of alert, even while they sleep. This explains why people who continue taking their medication exactly as prescribed still experience dizziness, heaviness in the legs, neck tension, or that uncomfortable pounding in the chest at night. What is truly revealing is that studies published in the European Heart Journal show that certain controlled isometric exercises, combined with diaphragmatic breathing and specific muscle activations, can improve arterial elasticity, reduce silent inflammation, and restore baroreflex control, the natural mechanism your body uses to regulate pressure, in a matter of days, not months. This opens an entirely new door. It's not just about moving, but about activating the internal mechanisms your body already has for self-regulation, mechanisms that weaken with age if not properly stimulated. And the most surprising part is that these improvements do not require strength, impact, or physical endurance, they require precision. That's why the methods you are about to discover can mark a before and after in your cardiovascular health. Secret 1. Leg elevation. Leg elevation, although it seems like a simple and common movement, is actually one of the most powerful tools to reduce blood pressure quickly and naturally, especially in people over 50 or 60 who experience ankle swelling, heavy legs, fluid retention, or poor venous circulation. When you elevate your legs above heart level, a profound physiological phenomenon occurs. The venous blood that usually stagnates in the lower extremities returns more easily to the heart, reducing hydrostatic pressure in the veins and decreasing cardiac workload. This, in turn, improves venous return and reduces peripheral resistance, which is one of the key factors that keep blood pressure elevated. Recent studies in geriatric hemodynamics have shown that elevating the legs for just 3 to 5 minutes activates the mechanism of endothelium-dependent vasodilation, the inner layer of blood vessels, stimulating the release of nitric oxide, a molecule that relaxes the arteries and improves blood flow. Additionally, this simple gesture reduces the activity of the sympathetic nervous system, which is often overactivated in people with hypertension, chronic stress, or poor sleep. When the sympathetic decreases and the parasympathetic increases, the body enters a calmer regulatory state, causing a natural drop in systolic and diastolic blood pressure values. But the most fascinating thing about the leg elevation exercise is its direct effect on baroreflex function, the system of internal sensors your body uses to detect pressure changes and adjust them automatically. With age, these baroreceptors, located in the carotid artery and the aortic arch, lose sensitivity, which makes the body no longer respond quickly to postural changes, generating dizziness, a feeling of faintness, or unstable readings on the blood pressure monitor. Leg elevation reactivates these sensors, training them to regulate pressure more effectively. It is like resetting the internal arterial control system, something especially useful for people who suffer from resistant or fluctuating hypertension. Additionally, elevating the legs reduces the accumulation of interstitial fluid, which relieves chronic low-grade inflammation, one of the silent causes that stiffens the arteries over time. From a neuromuscular perspective, this position also releases accumulated tension in the lower back, psoas, and even the respiratory muscles, which improves diaphragm efficiency and promotes deeper, more relaxed breathing. And, as is already known in modern scientific literature, diaphragmatic breathing is one of the most powerful tools to activate the vagus nerve and reduce blood pressure immediately. Altogether, leg elevation is not just a rest exercise, it is a therapeutic intervention that combines circulation, nervous regulation, respiratory activation, and reduced cardiac load. This is why thousands of older adults who practice it daily report lighter legs, fewer dizzy spells when standing up, better sleep, and more stable blood pressure readings. In essence, this first secret works as a simple yet profound reset for the cardiovascular system, an intelligent and accessible way to help the body return to its natural balance. Secret 2. The isometric glute bridge. The isometric glute bridge is one of the most powerful and underestimated exercises for reducing resting blood pressure, especially in people over 55 or 60 who are looking for a safe, low-impact, clinically proven alternative. Isometrics, static muscle contractions without joint movement, have been identified by multiple meta-analyses from the American Heart Association and publications such as Hypertension and the Journal of Applied Physiology as one of the most effective forms of training to lower blood pressure in older adults. Why do they work so well? Because this type of activation simultaneously recruits large muscle groups, which creates a moderate but controlled metabolic demand capable of stimulating deep vascular responses without excessively raising heart rate. In the case of the glute bridge, when you lift the pelvis and hold the contraction of the glutes, hamstrings, and core musculature, a strategic compression of the blood vessels in the pelvic area and legs occurs. This phenomenon is known as physiological temporary occlusion and forces the vessels to adapt, generating an immediate release of nitric oxide, NO, one of the most potent endogenous vasodilators in the human body. Nitric oxide not only dilates the arteries, but it also improves vascular elasticity, reduces arterial stiffness, and promotes more efficient blood flow. As this molecule acts on the smooth muscle of the arteries, systolic pressure decreases naturally, similar to what happens when you open a hose so that the water flows with less force. However, the impact of the glute bridge goes far beyond simple vasodilation. This isometric exercise improves baroreflex sensitivity, the system of internal sensors that regulates your blood pressure in real time, a mechanism that tends to weaken with age, sedentary lifestyle, or chronic stress. By strengthening posterior muscle chains such as the glutes and hamstrings, muscles that are often inhibited or weakened in older adults, lumbopelvic stability is restored, which reduces compensatory tension in the lower back, diaphragm, and spinal erectors. This is key because chronic muscle tension is directly related to the activation of the sympathetic nervous system, the same system that increases blood pressure when the body interprets that it is under threat. By activating and strengthening the posterior muscles in a controlled, pain-free way, the glute bridge generates a neuromuscular reset effect, decreasing sympathetic tone and promoting parasympathetic dominance, which is responsible for physiological calm. Additionally, recent studies have shown that sustained isometric training for 2 to 3 weeks can reduce systolic pressure by 10 to 12 millimeters of mercury cumulatively, results comparable to, and in some cases superior to, traditional aerobic exercises such as walking or cycling. And the best part is that the glute bridge is extremely safe, does not impact the joints, does not require a wide range of motion, and can be easily adapted to any fitness level, even for people with lower back pain, osteoarthritis, or mobility limitations. In this way, this second secret not only strengthens your body, it activates the most important physiological mechanisms for regulating blood pressure, rejuvenates your arteries from the inside out, and offers you a scientifically proven method to improve your cardiovascular health without machines, complex routines, or strenuous effort. Secret 3. Heel raises. The calves are called the second heart for a surprising and tremendously underestimated reason. They are responsible for pushing up to 70% of the venous return from the lower limbs back to the heart. For the blood to overcome gravity and travel from the feet to the chest, it needs the help of the soleus and gastrocnemius muscles, which act as a powerful hydraulic pump every time they contract. When these structures are weak, stiff, or inactive, something common in older adults or those who spend many hours sitting, venous return slows down, blood accumulates in the legs and ankles, and blood pressure tends to rise because the heart must pump harder to compensate for this stagnation. Modern science has identified sedentarism as one of the main hidden causes of hypertension, especially in adults over 60. According to research published in Circulation and the Journal of Vascular Medicine, prolonged inactivity deteriorates the function of the soleus gastrocnemius pump, reduces the ability of the deep veins to move blood properly, and increases the risk of chronic inflammation, varicose veins, nighttime cramps, and edema. Heel raises, although incredibly simple, immediately reactivate this venous pump. When the heel is lifted, the soleus compresses the deep veins of the calf, generating an active compression effect that literally squeezes the blood upward, improving circulation, reducing hydrostatic pressure in the legs, and decreasing the heart's workload. This movement, repeated several times a day, stimulates venous return so effectively that several studies show sustained reductions in blood pressure and noticeable improvements in symptoms such as heavy legs, swollen ankles, and tingling sensations. But what is truly fascinating is the neuromuscular and cardiovascular impact that heel raises generate when practiced regularly. This exercise not only activates the soleus and gastrocnemius, it also stimulates lymphatic function, reduces low-grade inflammation, and improves modulation of the autonomic nervous system, which is responsible for regulating blood pressure in milliseconds. As blood ascends more efficiently, the heart experiences less overload and systolic pressure tends to stabilize. Additionally, repeated activation of the second heart improves the elasticity of the arteries in the legs, a key factor in preventing arterial stiffening that accompanies aging and contributes to chronic hypertension. This movement is so simple that you can do it while brushing your teeth, cooking, or waiting for the water to boil, and it still produces profound changes. In fact, vascular medicine experts recommend activating the calf every 45 minutes in older adults, especially if they share risk factors such as diabetes, hypertension, or venous insufficiency. The benefits are not just theoretical. Thousands of people have experienced real improvements, with many reporting significantly reduced nighttime cramps, improved foot temperature, and decreased swelling after only a few weeks of practicing this third secret several times a day. The key is consistency. Activating the second heart daily restores venous return, reduces blood pressure, and protects the arteries from progressive deterioration that, without intervention, advances silently for years. That's why this small but powerful exercise becomes an essential tool for those who want to keep their cardiovascular health in balance without complicated routines or excessive effort. Secret 4. Diaphragmatic breathing exercises. Diaphragmatic breathing is, without exaggeration, one of the most powerful, immediate, and scientifically proven methods to reduce blood pressure, especially in older adults whose breathing often becomes shallow, rapid, and dominated by the upper chest due to stress, sedentary lifestyle, and muscle stiffness. Unlike thoracic breathing, which activates the sympathetic nervous system and increases heart rate and pressure, deep diaphragmatic breathing directly stimulates the vagus nerve, the main regulator of the parasympathetic system responsible for bringing the body into a state of physiological calm. When you inhale deeply, allowing the abdomen to expand, the diaphragm descends and performs an internal massage on vital organs such as the heart, lungs, and digestive system, improving cellular oxygenation, reducing muscle tension, and decreasing peripheral vascular resistance. Studies published in the Journal of Human Hypertension have shown that just 5 to 8 minutes of diaphragmatic breathing can reduce systolic blood pressure by 5 to 15 millimeters of mercury in a short period. This occurs because deep breathing increases heart rate variability, HRV, a key indicator of autonomic nervous system health. The higher the HRV, the better the body's ability to adapt to stress and maintain stable blood pressure. In addition, diaphragmatic breathing reduces the production of cortisol, the stress hormone, and improves gas exchange in the lungs, allowing the heart to work with less effort and greater efficiency. But the most fascinating and lesser-known part of this secret is its impact on arterial stiffness and the internal mechanisms that regulate pressure. With age, the diaphragm tends to become less flexible due to poor posture, weakness of core muscles, accumulation of emotional stress, and altered breathing patterns. When the diaphragm does not move properly, the ribcage loses mobility, blood flow to the lower body decreases, and the nervous system interprets this limitation as a threat, automatically raising blood pressure. Diaphragmatic breathing reverses this process. By training the deep and controlled movement of the diaphragm, thoracic stiffness is reduced, trunk circulation improves, and tension in the phrenic nerve and scalene muscles is released, areas that often coexist with hypertension, neck pain, and dizziness. Furthermore, abdominal breathing enhances venous return, reducing the workload on the heart and improving the function of the baroreflex, the internal sensors that detect pressure changes, which tend to deteriorate with age. This is why many older adults, after practicing these exercises for several weeks, report not only lower blood pressure readings, but also improvements in sleep, less anxiety, disappearance of palpitations, and an overall sense of internal stability. Diaphragmatic breathing thus becomes a comprehensive therapeutic tool. It regulates pressure, calms the mind, rejuvenates blood vessels, and restores a bodily balance that silently deteriorates over time. This fourth secret requires no strength, flexibility, or physical condition. It only requires presence, consistency, and a few minutes a day to activate one of the deepest mechanisms the body has for self-regulation. Secret 5. The cumulative effect. The reason this secret works has nothing to do with extreme willpower or long training sessions, but with one of the most studied principles in behavioral neuroscience, microhabits. Researchers at Stanford University, led by Dr. B.J. Fogg, have demonstrated that the human body responds better to small, easy, and repeated stimuli than to intense but sporadic efforts. Physiology confirms this as well. When you dedicate just 5 daily minutes to activating key muscles, stimulating diaphragmatic breathing, moving the second heart, or using isometric exercises, you are sending constant signals to your cardiovascular, neurological, and metabolic systems. These signals, although brief, generate deep adaptations, progressive increase of nitric oxide in arterial walls, reduction of vascular stiffness, decrease of sympathetic tone, the fight or flight mode, and a significant improvement in heart rate variability, one of the most powerful biomarkers for measuring health and longevity. 5 minutes may not seem like much, but for the body they represent a daily dose of physiological stimulus that optimizes blood flow, improves the endothelium's ability to relax and contract, and corrects imbalances caused by decades of sedentary lifestyle, chronic stress, and lack of movement. Modern exercise science has made it clear that extreme intensity is not the only path to better health. In fact, for adults over 50 or 60, the key lies in frequent stimulation plus low friction. That is why this secret is so powerful. It eliminates excuses, reduces mental resistance, and makes possible a change that anyone can sustain even on their busiest or most tired days. And it is precisely this daily repetition that causes what scientists call adaptive accumulation, a phenomenon in which small doses of exercise, performed consistently, generate greater improvements than long but irregular programs. In 30 days, you will notice the first signs: lower resting blood pressure, lighter legs, better sleep quality, and a constant feeling of calm throughout the day due to decreased cortisol. In 60 days, the endothelial system becomes significantly more efficient, arteries regain part of their lost elasticity, and circulation improves noticeably, reducing inflammation, swelling, and fatigue. And at 180 days, something even deeper occurs: your basal physiology changes. Your body no longer lives trapped in chronic stress or the cardiovascular stiffness that comes with aging. It now responds faster, recovers better, and maintains more stable blood pressure throughout the day. All thanks to 5 minutes a day. This is not magic, it is science, consistency, and intelligent design of the human body. Every minute counts and every repetition leaves a positive mark. That is why this secret works for men and women of any age, even for those who believe it is too late or that they don't have time. The truth is that you can transform your heart, your arteries, and your energy with a minimal routine, as long as you do it every day. That is the true superpower, the cumulative effect that turns 5 minutes into a complete transformation of your cardiovascular health. The 5 secrets revealed form a comprehensive cardiovascular system that acts not only on visible symptoms such as swelling, elevated blood pressure, cramps, or the feeling of fatigue, but also on the deepest mechanisms that control vascular health and the autonomic balance of the body. The fascinating thing is that each secret acts on a different layer of the organism, but all converge toward the same objective: restoring the efficiency of venous return, improving arterial elasticity, and giving your nervous system back the ability to self-regulate. Leg elevation optimizes hemodynamics and reactivates baroreceptors. The glute bridge strengthens the posterior muscle chains and generates isometric vasodilation. Heel raises reactivate the second heart and drain the deep veins. Diaphragmatic breathing calms the sympathetic nervous system and makes the ribcage more flexible. And the cumulative effect integrates all of this into a daily adaptation process that reprograms the body to function better with less effort. When these interventions are combined, the body experiences a cascade of benefits: increased nitric oxide, improved microcirculation, decreased systemic inflammation, cortisol regulation, and rejuvenation of the endothelium. In other words, what you are doing is not simply moving muscles or relaxing a bit, but acting directly on the physiological pillars that determine blood pressure, energy state, and longevity. Modern science supports it. Small interventions strategically distributed throughout the day have a more powerful effect than long sessions of irregular exercise. By activating the legs, core, diaphragm, and venolymphatic system, you are restoring a complete bodily ecosystem that modern life, sedentary lifestyle, stress, poor posture, lack of oxygenation, has been wearing down for years. In addition, this system has a direct impact on the way your body perceives and responds to stress. Research in neurocardiology has shown that blood pressure is not only a mechanical phenomenon, but also emotional and neurological. A rigid diaphragm, inactive calves, or poor venous return send alert signals to the brain, activating defense mode and raising blood pressure without you realizing it. But by applying these 5 secrets consistently, what you are doing is retraining the nervous system so that it stops interpreting movement as a threat and perceives it as regulation. The body begins to regain something it had lost: the ability to remain stable even in the face of external stimuli. Sympathetic hyperreactivity decreases, parasympathetic influence increases, pressure spikes soften, and vascular tone improves, making your arteries function like they did when you were younger. And the most valuable part is that this process does not require strength, speed, or endurance. It requires consistency, intention, and the understanding that small repeated actions have a gigantic impact on human physiology. In older adults, this is crucial. Studies show that the combination of isometric exercises, venous pump activations, deep breathing, and daily micro-habits has a cumulative effect that can reduce the risk of cardiovascular events by up to 30%. This system is accessible to everyone because it is designed to align with how the body truly works. It doesn't fight against age, it works with it. It doesn't demand more from the heart, it frees it. It doesn't force the nervous system, it educates it. What you have in your hands is not 5 exercises, but an integral method that rebuilds your cardiovascular health, your daily energy, and your sense of balance from the inside out. A simple, powerful, and scientifically supported system that transforms lives in just 5 minutes a day. In the end, everything comes down to a single decision: start today. It doesn't matter your age, your fitness level, or how long you've gone without moving. What does matter is that now you know a simple, scientific, and proven method to transform your body and your health in just minutes a day. If you want to keep receiving secrets like these, easy routines, exercises for all ages, and real strategies that actually work, give this video a like, subscribe to the channel right now, and activate the notification bell, as your heart, your legs, and your energy will thank you for it. Remember, the first step is yours. Your body and your health will thank you. Thank you for watching this video and see you soon.